2024 Consumer Confidence Report for West Bridgewater Water Department. The West Bridgewater Water Department is located at 29 Sear Street. The West Bridgewater Water Superintendent, Wayne Parks, can be reached at 508-894-1271. The West Bridgewater Water Systems is routinely inspected by the Massachusetts Department of Environmental Protection, or MassDEP. MassDEP inspects our system for its technical, financial, and managerial capacity to provide safe drinking water to you. To ensure that we provide the highest quality of water available, your water system is operated by Massachusetts certified operators who oversee the routine operations of our system. As part of our ongoing commitment to you, last year we made the following improvements to our system. During 2024, we undertook the replacement of hydrants. We replaced various components within our system. We also worked with customers when they called upon us for help. Opportunities for public participation. If you would like to participate in discussions regarding your water quality, you may attend the following meetings on educational events. The Water Commission meets the first and third Monday of every month except when holidays interfere. Your drinking water source. Where does my drinking water come from? Your water is provided by the following sources listed below. We are a groundwater not under the influence of surface water. Source name, Sear Street Station 1, well, number 1A. Source type, groundwater. Location of source, Sear Street. Sear Street Station 1, well, number 1B. Source type, groundwater. Location of source, Sear Street. Norman Ave, Station 2, well, number 2. Source type, groundwater. Location of source, Norman Ave. Manley Street Station 3, well number 3A. Source type, groundwater. Location of source, Manley Street. Manley Street Station 3, well number 3B. Source type, groundwater. Location of source, Manley Street. Sear Street Station 4, well number 4. Source type, groundwater. Location of source, Sear Street. Sear Street Station 4, well number 5A. Source type, groundwater. Location of source, Sear Street. Please note, residents of Turnpike Street and Ranker Drive are served by Easton's public water supply. Is my water treated? The West Bridgewater Water System makes every effort to provide you with safe and pure drinking water. To improve the quality of the water delivered to you, we treat it to protect you from contaminants. We add a disinfectant to protect you against microbial contaminants. We do corrosion control to the water to reduce lead and copper levels. We chemically treat the water to reduce levels of iron and manganese at Manley Street. We use sequestering agent to prevent mineral buildup in our distribution system. The water quality of our system is constantly monitored by us and the MassDEP to determine the effectiveness of existing water treatment and to determine if any additional treatment is required. Residents can help protect sources by practicing good septic system maintenance, supporting water supply protection initiatives at the next town meeting, taking hazardous household chemicals to hazardous materials collection days, limiting pesticide and fertilizer use. MassDEP has prepared a source water assessment program, otherwise known as SWAP, to report for the water supply sources serving this water system. The SWAP report assesses the susceptibility of water public supplies. What is my water system's ranking? A susceptibility ranking of high was assigned to this system using the information collected during the assessment by MassDEP. Where can I see the SWAP report? The complete SWAP report is available at the Water Department website. Look for SWAP report and online at mass.gov. At this time, the current SWAP report is out of date. Substances found in tap water. Sources of drinking water, both tap water and bottled water, include rivers, lakes, streams, ponds, reservoirs, springs, and wells. As water travels over the surface of the land or through the ground, it dissolves naturally occurring minerals, and in some cases, radioactive material, and can pick up substances resulting from the presence of animals or from human activity. Contaminants that may be present in a water source include microbial contaminants such as viruses and bacteria, which may come from sewage treatment plants, septic systems, agricultural livestock operations, and wildlife. Inorganic contaminants such as salts, metals, which can be naturally occurring or result from urban stormwater runoff. Industrial or domestic wastewater discharges, oil and gas production, mining, and farming. Pesticides and herbicides, which may come from a variety of sources such as agriculture, urban stormwater runoff, and residential uses. Organic chemical contaminants, including synthetic and volatile organic chemicals, which are byproducts of industrial processes and petroleum production, and can also come from gas stations, urban stormwater runoff, and septic systems. Radioactive contaminants, which can be naturally occurring or be the result of oil and gas productions and mining activities. In order to ensure that tap water is safe to drink, the Department of Environmental Protection, or Mass DEP, and the U.S. Environmental Protection Agency, the EPA, prescribe regulations that limit the amount of certain contaminants in water provided by public water systems. The Food and Drug Administration, or FDA, and Massachusetts Department of Public Health, DPH, regulate established limits and contaminants in bottled water that must provide the same protection for public health. First, a required mandatory educational statement. All drinking water, including bottled water, may reasonably be expected to contain at least small amounts of some contaminants. The presence of contaminants does not necessarily indicate the water poses a health risk. More information about contaminants and potential health effects can be obtained by calling the EPA's Safe Drinking Water Hotline, 800-426-4791. Second required mandatory educational statement. The sources of drinking water, both tap and bottled water, include rivers, lakes, streams, ponds, reservoirs, springs, and wells. As water travels over the surface of the land or through the ground, it dissolves naturally occurring minerals and in some cases radioactive material, and can pick up substances resulting from presence of animals and from human activity. Contaminants that may be present in source water include microbial contaminants such as virus, bacterials, which may come from sewage, treatment plants, septic systems, agricultural livestock, operations, and wildlife. Inorganic contaminants such as salts and metals, which may be naturally occurring or result from urban stormwater runoff, industrial or domestic. Wastewater discharges, oil and gas production, mining, or farming. Pesticides and herbicides, which may come from a variety of sources, such as agriculture, urban stormwater runoff, and residential uses. Organic chemical contaminants, including synthetic and volatile organic chemicals, which are byproducts of industrial processes and petroleum production, and can also come from gas stations, urban stormwater runoff, and septic systems. Radioactive contaminants, which can be naturally occurring or be the result of oil and gas production and mining activities. Third required mandatory educational statement. Some people may be more vulnerable to contaminants in drinking water than the general population. Immunocompromised persons such as persons with cancer undergoing chemotherapy, persons who have undergone organ transplants, people with HIV and AIDS or other immune system disorders, some elderly and some infants can be particularly at risk from infections. These people should seek advice from drinking water from their health care providers. EPA Centers for Disease Control and Prevention, otherwise known as the CDC, guidelines or lowering the risk of infection by cryptosporidium and other microbial contaminants are available from the Safe Drinking Water Hotline, 800-426-4791. Fourth required mandatory educational statement. In order to ensure the tap water is safe to drink, EPA and Mass DEP prescribe regulations that limit the amount of certain contaminants in water provided by public water systems. FDA and Massachusetts Department of Public Health regulations establish limits for contaminants in bottled water that must provide the same protections for public health. Important definitions. Maximum contaminant level, or MCL, the highest level of contaminant that is allowed in drinking water. The MCLs are set as close to the MCLGs as feasible using the best available treatment technology. Maximum contaminant level goal, MCLG. The level of contaminant in drinking water below which there is no known or exposed risk to health. MCLGs allow for margin of safety. Action level, or AL. The concentration of a contaminant which, if exceeded, triggers treatment of other requirements that a water system must follow. 90th percentile. Out of every 10 homes sampled, 9 were at or below this level. Secondary maximum contaminant level, or SMCL. These standards are developed to protect the aesthetic qualities of drinking water and are not health-based. Unregulated contaminants. Unregulated contaminants are those for which EPA has not established drinking water standards. The purpose of unregulated monitoring is to assist EPA in determining their occurrence in drinking water and whether future regulation is warranted. Massachusetts Office of Research and Standards Guidelines, or ORSG. This is the concentration of a chemical in drinking water at or below which adverse health effects are unlikely to occur after chronic, lifetime exposure. If exceeded, it serves as an indicator of the potential need for further action. Treatment technique, or TT. A required process intended to reduce the level of contaminant in drinking water. Running annual average, or RAA, the average of 4 consecutive quarter of data. Maximum residual disinfectant level, or MRDL, the highest level of disinfectant, chlorine, chloramines, chlorine dioxide allowed in drinking water. There is convincing evidence that addition of disinfectant is necessary for control of microbial contaminants. Maximum residual disinfectant level goal, or MRDLG. The level of drinking water disinfectant, chlorine, chloramines, chlorine dioxide, below which there is no known expected risk to health. MRDLGs do not reflect the benefit of the use of disinfectants to control microbial contaminants. Level 1 assessment. A Level 1 assessment is a study of the water system to identify potential problems and determine, if possible, why total coliform bacteria have been found in our water system. Definitions. ppm, parts per million, or 1 drop in a million gallons. ppb, parts per billion, or 1 drop in a billion gallons. ppt, parts per trillion, or 1 drop in a trillion gallons. PCI/L, picocuries per liter, a measure of radioactivity. ND, not detected. NA, not applicable. UG/L, micrograms per liter, equals PBB, parts per billion. NG/L, nanogram per liter, equals PPT, parts per trillion. Water quality testing results. What does this data represent? The water quality information presented in the table is from the most recent round of testing done in accordance with the regulations. All data shown was collected during the last calendar year unless otherwise noted in the table. Lead and copper results from the 2024 System Survey. Lead ppb. Dates collected June 21st through July 23rd, 2024. 90th percentile, 2. Action level, 15. MCLG, 0. Number of sites sampled, 22. Number of sites above action level, 0. Possible source of contamination, corrosion of household plumbing systems, erosion of natural deposits. Copper, ppm. Dates collected April 24th to June 9th, 2024. 90th percentile, 0.13. Action level, 1.3. MCLG, 1.3 parts per million. Number of sites sampled, 22. Number of sites above action level, 0. Possible source of contamination. Corrosion of household plumbing systems, erosion of natural deposits, leaching from wood preservatives. Fifth, required mandatory educational statement. Lead can cause serious health effects in people of all ages, especially pregnant people, infants, both formula-fed and breastfed, and young children. Lead in drinking water is primarily from materials and parts used in service lines and home plumbing. The West Bridgewater Water Department is responsible for providing high-quality drinking water and removing lead pipes, but cannot control the variety of materials used in the plumbing in your home. Because lead levels may vary over time, lead exposure is possible even when your tap sampling results do not detect lead at one point in time. You can help protect yourself and your family by identifying and removing lead materials within your home plumbing and taking steps to reduce your family's risk. Using a filter certified by an American National Standards Institute accredited certifier to reduce lead is effective in reducing lead exposures. Follow the instructions provided with the filter to ensure the filter is used properly. Use only cold water for drinking, cooking, and making baby formula. Boiling water does not remove lead from water. Before using tap water for drinking, cooking, or making baby formula, flush your pipes for several minutes. You can do this by running your tap, taking a shower, doing laundry, or a load of dishes. If you have a lead service line or galvanized required replacement service line, you may need to flush your pipes for a longer period. If you are concerned about lead in your drinking water and wish to have your water tested, contact the West Bridgewater Water Department for information on lead in drinking water. Testing methods and steps you can take to minimize exposure is available at epa.gov/safewater/lead. The Mass DEP has reduced the monitoring requirements for asbestos, next sample, 2031. Gross alpha particle activity, next samples due 2030. Lead and copper, we are currently on a 1-year sample plan. Radium, 226 and radium 228, next sample due 2030. Because the source is not at risk of contamination. Microbial contaminants. Coliforms are bacteria that are naturally present in the environment and are used as an indicator that other potentially harmful waterborne pathogens may be present on the potential pathways exist through which contaminants may enter the drinking water distribution system. We found coliforms indicating the need to look for potential problems in water treatment or distribution. When this occurs, we are required to conduct assessments to identify any problems that were found during these assessments. Bacteria, E. coli. Maximum containment level and treatment technique, 0. Maximum containment level, 0. Value, positive, E. coli. Date, not available. Violation, no. Possible sources, human and animal fecal waste. Total coliform bacteria. Maximum containment level and treatment technique, 0. Maximum containment level, 0. Value, positive. Date, not available. Violation, no. Possible sources, human and animal fecal waste. On June 3, 2024, we had a raw water detect Manley Street well 3A for coliform bacteria testing. On June 4, 2024, we had a raw water detect Manley Street well 3A for coliform bacteria testing. Manley Street is a 4-log compliant, which means that no retesting is required for total coliform detects. 4-log means we have to carry a certain amount of free chlorine residual for a certain amount of contact time prior to delivery to the first customer. Total coliform. Coliforms are bacteria that are naturally present in the environment and are used as an indicator that other potentially harmful bacteria may be present. If we had to do a level 1 or 2 assessment, it is because we found coliforms in more samples than allowed, and this was a warning of potential problems. The test is based on presence or absence, which means you are allowed 0. Inorganic contaminants. Contaminant unit of measure. Nitrate report. Nitrate parts per million. Dates tested February 23rd, June 22nd, 2024. Highest result 2.69. Range of results 0.31 to 2.69. Maximum contaminant level, 10. Violation, no. Possible sources, runoff from fertilizer, use of leaching from septic tanks, sewage, erosion of natural deposits. Nitrate report. Nitrate parts per million. Dates tested February 6. Highest result, not detected. Range of results, not available. Maximum contaminant level, 1. Violation, no. Possible sources, runoff from fertilizer use, leaching from septic tanks, sewage, erosion of natural deposits. Perchlorate report. Perchlorate parts per billion. Dates tested August 20th, 2024. Highest result, 0.55. Range of results, 0.12 to 0.55. Maximum contaminant level, 2. Violation, no. Possible sources, rocket propellants, fireworks, munitions, flare blasting agents. Arsenic report. Arsenic parts per billion. Dates tested January 22nd, April 22nd, May 7th, August 20th, November 19th, 2024. Highest results, not detected. Range of results, not detected. Maximum contaminant level, 10 parts per billion. Violation, no. Possible sources, erosion of natural deposits, runoff from orchards, runoff from glass and electronics production waste. Sodium report. Sodium parts per million at stations 1, 2, and 3. Dates detected January 22nd, April 22nd, 2024. Highest result, 155. Range of results, 18.7 to 155. Maximum contaminant level, 20. Violation, not available. Possible sources, discharge from the use of improper storage of sodium contaminating de-icing compounds or in-water softening agents. Secondary contaminants. Contaminant unit of measure, magnesium report. Magnesium parts per billion, stations 1 offline 2. Dates tested, January 22nd, January 23rd, April 22nd, August 20th, and November 19th, 2024. Highest results, 1090. Range of results, 35 to 1090. Secondary maximum contaminant level, 300. Violation, not available. Possible sources, erosions of natural deposits. Radioactive contaminants. Contaminants unit of measure, radium-226 report. Radium-226 picocuries per liter. Dates tested, February 6th, April 20th, November 6th, 2023. Highest result, 0.900. Range of results, less than 0.180, 0.900. Maximum contaminant level, not available. Violation, not available. Possible sources, erosion of natural deposits. Radium-228 report. Radium-228 picocuries per liter. Dates tested, February 6th, April 20th, November 6th, 2023. Highest result, 0.860. Range of results, less than 0.570 to 0.860. Maximum contaminant level, not available. Violations, not available. Possible sources, erosion of natural deposits. Gross alpha report. Gross alpha picocuries per liter. Dates tested, February 6th, April 20th, August 18th, November 6th, 2023. Highest result, 6.69. Range of results, less than 1.31 to 6.69. Maximum contaminant level, 15. Violation, no. Possible sources, same as above. Synthetic organic compounds. Contaminant unit of measure, synthetic organic compounds report. Synthetic organic compounds parts per billion, station 1. Dates tested April 24th, December 2nd, 2024. Highest result, no. Range of results, no. Maximum contaminant level, not available. Violation, not available. Possible sources, not available. Volatile organic contaminants. Contaminant unit of measure, volatile organic compounds report. Station 4, dates tested January 23rd, 2024. Highest result, no. Range of results, no. Maximum contaminant level, not available. Violation, not available. Possible sources, not available. Contaminant unit of measure, tetrachloroethane, parts per billion, 4 locations. Dates tested, January 24th, 2024. Highest result, no. Range of results, not detected. Maximum contaminant level, not available. Violation, not available. Possible sources, not available. Disinfection by products and disinfectant residuals, otherwise known as TTHM and HAA5. Disinfectant contaminants report. Contaminant unit of measure, total haloacetic acids parts per billion. Dates tested, August 6, 2024. Highest result, 11.0. Range of results, 10.5 to 11.0. Maximum contaminant level, 60. Violation, no. Possible sources, byproduct of drinking water chlorination. Contaminant unit of measure, total trihalomethanes, parts per billion. Dates tested, August 6, 2024. Highest result, 39.2. Range of results, 39.2 to 24.5. Maximum contaminant level, 80. Violation, no. Possible sources, byproduct of drinking water chlorination. Per and polyfluoroalkyl substances, otherwise known as PFAS. Perfluorocarbons, PFAS-6. Contaminant unit of measure, stations 1, 2, and 4, parts per trillion. Dates tested, September 26, 2024. Highest result, 6.80. Range of results, 3.63 to 6.80. Maximum contaminant level, 20. Violation, no. Possible sources, not available. Unit of measure, Manley Street, parts per trillion. Dates tested, January 30th, February 27th, March 12th, March 19th, April 22nd, May 21st, June 25th, July 11th, August 18th, September 23rd, October 24th, November 18th, 2024. Highest result, 24.1. Range of results, 0.0 to 24.1. Maximum contaminant level, 20. Violation, yes. Possible sources, not available. Unregulated contaminants. UMCR 5 testing. Unregulated contaminant. Station 2, PFBS, nanogram per liter. Dates collected, June, December 2024. Result or range of detected, 3.4 to 4.2. Average detected, 3.85. Secondary maximum contaminant level, not available. Office of Research and Standard Guideline, not available. Possible sources, discharges and emissions from industrial and manufacturing sources associated with the production of use of these PFAS, including production of moisture and oil-resistant coatings on fabrics and other materials. Additional sources include the use of disposal of products containing these PFAS, such as firefighting foam. Station 2, PFHXA, nanograms per liter. Dates collected, June and December 2024. Range of results detected, 3.7 to 3.9. Average detected, 7.6. Secondary maximum containment level, not available. Office of Research and Standard Guidelines, not available. Possible sources, same as above. Station 2, PFOA, nanograms per liter. Dates collected, December 2024. Range of results detected, 5.0. Average detected, 5.0. Secondary maximum contaminant level, not available. Office of Research and Standard Guidelines, not available. Possible sources, same as before. Station 2, PFPEA, nanograms per liter. Dates collected, June and December 2024. Result or range of detected, 3.2 to 3.2. Average detected, 3.2. Secondary maximum contaminant level, not available. Office of Research, Standard Guidelines, not available. Possible sources, same as above. Unregulated contaminant, Manley Street, PFBA, nanograms per liter. Dates collected, June and December of 2024. Results or range detected, 7.4 to 11. Average detected, 9.2. Secondary maximum contaminant level, not available. Office of Research and Standard Guidelines, not available. Possible sources, same as above. Manley Street, PFHXA, nanograms per liter. Dates collected, June and December 2024. Results or range of detected, 9.9 to 13. Average detected, 11.5. Secondary maximum contaminant level, not available. Office of Research and Standard Guidelines, not available. Possible sources, same as above. Manley Street, PFOA, nanograms per liter. Dates collected, December 2024. Results or range detected, 4.1. Average detected, 4.1. Secondary maximum contaminant level, not available. Office of Research and Standard Guidelines, not available. Possible sources, same as above. Manley Street, PFPEA, nanograms per liter. Dates collected, June and December 2024. Results or range of detected, 10.9 to 17. Average detected, 13.95. Secondary maximum contaminant level, not available. Office of Research and Standard Guidelines, not available. Possible sources, same as above. Station 1, PFBS, nanograms per liter. Dates collected, December 2024. Result or range of detected, 3.7. Average detected, 3.7. Secondary maximum contaminant level, not available. Office of Research and Standard Guidelines, not available. Possible sources, same as above. Station 1, PFHXA, nanograms per liter. Dates collected, June and December 2024. Result or range detected, 4.1 to 4.8. Average detected, 4.45. Secondary maximum contaminant level, not available. Office of Research and Standard Guidelines, not available. Possible sources, same as above. Station 1, PFOA, nanograms per liter. Dates collected, December 2024. Result or range of detected, 5.5. Average detected, 5.5. Secondary maximum contaminant level, not available. Office of Research and Standard Guidelines, not available. Possible sources, same as above. Station 1, PFP-EA, nanograms per liter. Dates collected, June 2024. Results or range of detected, 3.6 to 4.1. Average detected, 3.85. Secondary maximum contaminant level, not available. Office of Research and Standard Guidelines, not available. Possible sources, discharges and emissions from industrial and manufacturing sources associated with the production or use of these PFAS, including production of moisture and oil-resistant coating on fabrics and other materials. Additional sources include the use of disposable products containing these PFASs, such as firefighting foam. West Bridgewater was part of the UMCR5 testing. The chart above is the result of those tests. Compliance with drinking water regulations. Does my drinking water meet current health standards? We are committed to providing you with the best water quality available. However, some contaminants that were tested last year did not meet all applicable health standards regulated by the state and federal government. Health effects statements. Unregulated contaminants are those for which there are no established drinking water standards. The purpose of the unregulated contaminant monitoring is to assist regulatory agencies in determining their occurrence in drinking water and whether future regulation is warranted. Manganese. Manganese is a naturally occurring mineral found in rocks, soil, groundwater, and surface water. Manganese is necessary for proper nutrition and is part of a healthy diet, but can have undesirable effects of certain sensitive populations at an elevated concentrations. The United States Environmental Protection Agency and Mass DEP have set a aesthetics-based secondary maximum contaminant level for manganese at 50 micrograms per liter, or 50 parts per billion. In addition, Mass DEP's Office of Research and Standards has set the drinking water guidelines for manganese, which closely follows the EPA Public Health Advisory for manganese. Drinking water may naturally have manganese, and when concentrations are greater than 50 parts per billion, the water may be discolored and taste bad. Over a lifetime, the EPA recommends that people drink water with manganese levels less than 300 parts per billion, and over the short term, EPA recommends that people limit their consumption of water with levels over 1,000 parts per billion. Primarily due to the concern about possible neurological effects, children younger than 1 year old should not be given water with manganese concentration over 300 parts per billion, nor should formula for infants be made with that water for more than a total of 10 days throughout the year. The drinking water guidelines for manganese differs from the EPA's health advisory because it expands the age group to which the lower manganese concentration applies for children less than 6 months of age to children up to 1 year of age to address concerns about children's susceptibility to manganese toxicity. See EPA Drinking Water Health Advisory for manganese at epa.gov or Mass DEP Office of Research and Standards for manganese at mass.gov. Sodium. Sodium is the sixth most abundant element on Earth and is widely distributed in soils, plants, waters, and foods. Most of the world has significant deposits of sodium-containing minerals, most notably sodium chloride, salt. Sodium and chloride occur naturally in water as a result of erosion or saltwater intrusion. When salt water from the ocean seeps into underground water supplies, sodium may reach both ground and surface water supplies as a result of residential, commercial, and industrial activity, such as road salting. Sodium is an unregulated secondary contaminant which we do exceed. PFAS 6. What health effects are associated with the exposure to PFAS 6? The Mass DEP drinking water standard is based on studies of the 6 PFAS substances in laboratory animals and studies of exposed people. Overall, these studies indicate that exposure to sufficiently elevated levels of 6 PFAS compounds may cause developmental effects in fetus during pregnancy and in breastfed infants. Effects on the thyroid, the liver, the kidneys, hormone levels, and the immune system have also been reported. Some studies suggested a cancer risk may exist following long-term exposure to elevated levels of some of these compounds. Mass DEP Drinking Water Program, 1 Winter Street, Boston, Mass. 02108 121720. Mass.gov Drinking Water Program 2. It is important to note that consuming water with PFAS 6 above the drinking water standard does not mean the adverse effects will occur. The degree of risk depends on the level of the chemicals and the duration of exposure. The drinking water standard assumes that individuals drink only contaminated water, which typically overestimates the exposure, and that they are also exposed to PFAS 6 from sources beyond drinking water, such as food. To enhance safety, several uncertainty factors are additionally applied to account for differences between test animals and humans, and to account for differences between people. Scientists are still working to study and better understand the health risk posed by exposure to PFAS 6. If your water has been found to have PFAS 6 and you have specific health concerns, you may wish to consult with your doctor. Public notice: important information about your drinking water. Monitoring requirements not met for West Bridgewater Water Department. Our water systems violated several drinking water standards over the past year. Even though these were not emergencies, as our customers, you have the right to know what happened and what we did to correct these issues. What happened? We are required to monitor your drinking water for specific contaminants on a regular basis. Results of the regular monitoring are an indicator of whether or not our drinking water meets health standards. During quarter 2, we did not complete all monitoring or testing for arsenic at well 2 and therefore cannot be sure of the quality of our drinking water during that time. What is being done? We did complete the test for arsenic in quarter 3. The results for the test was 0, no detection. What should I do? There is nothing you need to do at this time. The table below lists the contaminants we did not properly test for during the last year. How often we are supposed to sample for these contaminants, and how many samples are we supposed to take, how many samples we took, and when samples should have been taken, and the date of which following up samples were or will be taken. Contaminant: arsenic. Required sampling frequency: 1 sample every 3 years. Number of samples taken: 1. When all samples should have been taken: quarter 2, 2024. When samples were or will be taken: quarter 3, 2024. For more information, please contact West Bridgewater Water Department at 508-894-1271 or 29 Sear Street at West Bridgewater, Mass. 02379. Public notice: important information about your drinking water. Availability of monitoring data for unregulated contaminants for West Bridgewater Water Department. As required by U.S. Environmental Protection Agency, our water system has sampled for a series of unregulated contaminants. Unregulated contaminants are those that do not yet have a drinking water standard set by the EPA. The purpose of monitoring for these contaminants is to help EPA decide whether the contaminants should have a public health protection standard. What should I do? You do not have to do anything, but as our customers, you have a right to know that these data are available. For additional information on your water and unregulated contaminants we sampled for, see your water department's Consumer Confidence Report, or CCR, or call a water quality report delivered by your water department by July 1st of each year. If you have any questions about your Consumer Confidence Report, see the contact information below for your water department. For more information on the Unregulated Contaminants Monitoring Program, visit the MassDEP website and navigate to Unregulated Contaminants Monitoring Program. If you want to speak with someone at the Water Department about the results, please contact Wayne Parks at 508-894-1271 or at wparks@wbridgewater.gov. This notice is being sent to you by West Bridgewater Water Department. Educational information: cross-connection control and backflow prevention. The West Bridgewater Water Department makes every effort to ensure that the water delivered to your home and business is clean, safe, and free of contamination. Our staff works very hard to protect the quality of the water delivered to our customers from the time the water is extracted via deep wells, from underground aquifers, or draw point from a surface water source, throughout the entire treatment and distribution system. But what happens when the water reaches your home or business? Is there still a need to protect the water quality from contamination caused by a cross-connection? If so, how? What is cross-connection? A cross-connection occurs whenever the drinking water supply is or could be in contact with potential sources of pollution or contamination. Cross-connections exist in piping arrangements or equipment that allows the drinking water to come in contact with non-potable liquids, solids, or gases, hazardous to humans in event of a backflow. What is a backflow? Backflow is the undesired reverse of the water flow in the drinking water distribution lines. This backwards flow of water can occur when the pressure created by the equipment or a system such as a boiler or air conditioning is higher than the water pressure inside the water distribution line, or back pressure, or when the pressure is in the distribution line drops due to routine occurrences such as water main breaks or heavy water demand causing the water to flow backwards inside the water distribution system, or back siphonage. Backflow is a problem that many water consumers are unaware of, a problem that each and every water customer has a responsibility to help prevent. What can I do to help prevent a cross connection? Without the proper protection, something as simple as a garden hose has the potential to contaminate or pollute the drinking water lines in your house. In fact, over half of the country's cross connection incidents involve unprotected garden hoses. There are very simple steps that you as a drinking water user, can take to prevent such hazards. They are: never submerge a hose in soapy water buckets, pet watering containers, pools, tubs, sinks, drains, or chemicals. Never attach a hose to a garden sprayer without a proper backflow preventer. Buy and install a hose bib vacuum breaker in the threaded water fixture. The installation can be as easy as attaching a garden hose to a spigot. This inexpensive device is available at most hardware stores and home improvement centers. Identify and be aware of potential cross connections to your water line. Buy appliances and equipment with backflow preventers. Buy and install backflow prevention devices or assemblies for all high and moderate hazard connections. If you are the owner or manager of a property that is being used as a commercial, industrial, or institutional facility, you must have your property's plumbing system surveyed for cross connection by your water purveyor. If your property has not been surveyed for cross connections, contact your water department to schedule a cross connection survey. What is a cross connection and what can I do about it? A cross connection is a connection between the drinking water pipe and polluted source. The pollution can come from your own home. For instance, you're going to spray fertilizer on your lawn. You hook up the hose to the sprayer that contains the fertilizer. If the water pressure drops at the same time you turn on the hose, the fertilizer may be sucked back into the drinking water pipes through the hose. This problem can be prevented by using an attachment on your hose called a backflow prevention device. The West Bridgewater Water Department recommends the installation of a backflow prevention devices such as a low-cost hose bib vacuum breaker for all inside and outside hose connections. You can purchase this at a hardware store or a plumbing supply store. This is a great way for you to help protect the water in your home as well as drinking water system in your town. For additional information on cross connections and on status of your water system cross connection program, please contact the Water Department. Additional information. Part of our Mass DEP water withdrawal permit is required water restrictions from May 1st to September 30th, alternating odd-even use according to your address, and water use restrictions between 9 a.m. and 5 p.m. Please pay attention to the town's website and signage around town. Please use our natural resources wisely. Following the use of restrictions helps flatten the demand curve and keeps our aquifers sustainable.